Welcome to our Lively U Virtual Learning Academy program. This program is presented by St. Luke's Family Medicine Residency, McLaren St. Luke's Family Medicine Residency. And our speaker today is Dr. Leslie Clemensen, and our topic is Parkinson's. Please welcome Leslie.
Good morning, everyone. It's nice to see everyone this morning. I do also have with me Stephanie Busick. She is a pharmacy resident in our program, and she's also going to present some information on the treatment portions for Parkinson's disease, because that's kind of her area of expertise. So we'll start initially with kind of the definition of Parkinson's disease. I think most folks have probably heard of it in the past, or maybe even know someone who has Parkinson. It is a neurodegenerative disorder, which means essentially that you lose neurons, which are the cells in the brain that make up the brain and also provide the communication so that we can think and do things. It is usually a progressive disease in that most people start with very minor or minimal symptoms, oftentimes maybe not even noticed for a while. And then as the disease progresses, they develop more and more signs and symptoms. What happens specifically with this disorder is that the nerve cells that are responsible for making dopamine, which is an important chemical in the brain that helps us regulate our movement. Those are the nerve cells or the neurons that are lost. And so most folks probably, if you've met someone with Parkinson's, you think about having tremors, or maybe problems with walking or balance. Those are some of the most common signs and symptoms associated with the disease. And as the dopamine levels in the brain decrease, you'll notice that people will have a tremor, typically on one side of the body versus another. And it usually can start in the hands or in a hand on one side. And it is a tremor that occurs when you are at rest. So if you go to pick up your cup of coffee and take a drink, there's no tremor. But if you're sitting watching television and your hand is at rest, you will likely have a tremor, and it's called a pill rolling tremor. And I'm going to try to show that to you. You'll kind of see people that kind of have this little bit of a tremor like this. And it's almost like it gets the term from kind of the roll, like if you imagine a pill being rolled between my thumb and my fingers. And so that is often the initial tremor that is seen in patients. The other symptoms that tend to happen is something called rigidity or muscle stiffness. And patients will develop, usually again in one side versus another, a stiffness in their arm, sometimes a leg, but usually starts in an upper extremity. And we call it, or people will often describe it as a weakness, or maybe the arm feels tired. And what we find when we examine someone is that they have kind of a stiff muscle movement in their arm. If you can kind of see me moving my arm, and their muscles are very rigid. And that is as a result of the loss of dopamine in the brain. So as things progress without treatment, treatment is to help slow down the progression of the disease and control signs and symptoms. Without that, you'll see progression of loss of movement, essentially, where people will become very slow moving. They will walk slowly. They will even move their arms, their hands, even their head in a manner that seems to be kind of slow and abnormal. People will complain of taking a long time or having a lot of difficulty in buttoning their clothes or tying their shoes, doing some of those fine motor things. And then as time goes, again, without treatment, you'll see folks have a change in their general posture. They will be bent forward at the waist, and when they walk, the overall timing in the walk, the time that it takes to walk a distance will increase, but actually you'll notice that their steps become much shorter. And so they make short steps that are really kind of quick, and it looks like someone is shuffling. So we call it a shuffling gait. Um, Outside of movement problems and tremors, we see people having an onset of dementia. They'll have some memory loss, and typically short term, then some of the long term memory. We'll see people who have hallucinations, typically visual hallucinations, where they see things that aren't actually there. Um, Other areas that we notice, and in fact, this can be kind of an early sign, is the loss of the sense of smell or the sense of taste. And sometimes people don't recognize it right away. And often if it's subtle, they may not even report it to their doctor. And so it's one of those things that can get missed. Somewhat associated with that is difficulty swallowing, and that will come with time. If you have more and more loss of dopamine in the brain, you will have difficulty controlling the muscles that allow us to swallow our food and our water. Another sign or symptom that you will find with patients is that their handwriting will change. It's actually called micro, as in very tiny, micrographia. So it's a kind of a, I think it's a classic sign of Parkinson's disease, where the person there who would normally write, say, in a format that's large and easy to read, will actually start to write so tiny that you can't even read the letters. And that is just a classic sign of someone who's suffering from Parkinson's disease. The areas that we, or the people who get Parkinson's disease are typically older. 60 and above is the most typical age group. Some folks can have signs or symptoms earlier, but usually the 60 to 65 mark is where we see people who actually have symptoms. It is more common in men than women. And there are about 60,000 new cases that are diagnosed every year in the United States. And that equals out to about, I kind of do the average of about 150 new cases for every 100,000 people in the US. It is more common in the Caucasian group. And we do know that there are some genetic markers and genetic predispositions for developing Parkinson's disease. And we have found that there are associations with environmental factors, some of those being exposure to pesticides or herbicides, and then also being exposed to things like well water. Some people have well water and drink water that is, I assume, probably filtered, but maybe not treated for removal of things like runoff from pesticides and herbicides that would be used in the farms. So there is some association to that, but we don't actually know the exact cause of Parkinson's disease in most cases. So Stephanie's going to take over here, and she's going to talk a little bit about how we treat Parkinson's disease and some of the important things that are associated with the different medications that we use to treat Parkinson's. Does anyone have any questions before we turn over to the treatment portion?
I don't know if you can hear me or not.
We can.
Oh, okay. I've been getting this, the little shakiness in the hands. I remember a great uncle who had that also.
Mm-hmm.
So I can see the genetic predisposition there. But, I haven't had any really drastic symptoms, except I've had cold legs and cold feet for a number of years now. And
Mm-hmm.
I've had tests done as far as blood circulation, and that's all fine.
Mm-hmm.
And I just wondered if that might be a symptom also, cold legs and feet. Just, even year round, even in the summertime, sometimes you have to throw, electric throw or electric
Blanket.
put them over those, the lower legs and the feet. And my doctor's kind of puzzled about, what it is. He thinks it's neurological, but I haven't seen a specialist yet.
Okay.
I just wondered about if it could be related to Parkinson's.
I don't think there's any association specifically with coldness in extremities or with even with a known vascular problem, with a vessel problem. So it's unlikely to be related. And your tremor, it could be or could not be. There are multiple causes of tremor. It is something though that you would have to look at with your physician to see if there are any other signs or symptoms and anything that needs to be addressed there.
Yeah, I'm a vascular surgeon that's going to remove a carotid body tumor from my
Okay.
right side
Mm-hmm.
of my neck. And maybe that's, got to do with my little shakiness in my hand. I don't know, but we'll see what happens, after that's removed and what kind of symptoms I have after that.
Okay. Well, yes, good luck with that. I would certainly want you to make sure that you do follow up with the surgeon there.
Thank you. And that's going to be at St. Luke's McLaren.
Oh, okay.
Dr. Afridi.
Great.
Sophia. Maybe you know her.
Yep, we do. We do work with Dr. Afridi. I'm sure they'll take great care of you.
Oh, I'm sure they will. Thanks for answering my question.
You're welcome.
All right, thank you, Dr. Clemensen. Good morning, everyone. So as Dr. Clemensen
Sorry, we're just having a little hard time hearing you.
Oh, okay. Can you hear me better now?
Yes. Yes.
Yep. Okay. Awesome. Okay. Sorry about that. So yes, good morning, everyone. So as Dr. Clemensen said, the cause of Parkinson's is due to a decrease in dopamine. So the medications we have to treat Parkinson's are really aimed at increasing the amount of dopamine in the body or helping it stay around longer. Something that's important to know with the therapy is that it's not going to cure the disease by any means. It's really just to help the patient who has Parkinson's function normally to the best of their ability, be able to go out and do things they want to do, go shopping or hang out with friends, things like that. We want to make sure that they have the mobility to do so. So one of our mainstays of treatment, you might have heard of carbidopa-levodopa, also known as Sinemet. And that's the workhorse for our therapy. It works by replacing the dopamine. Something that you might see in patients on this medication is they might look kind of restless. They might have these kind of abnormal movements, kind of these like rhythmic dancing-like motions that can be hard to stop at times. Also, this medication could cause a low blood pressure. So it's important that's also keeping an eye on that because we don't want the patient to have a fall. And then unfortunately with this medication, over time, the effects do wear off. So we'll usually have to add another medication. So an example of this would be the one listed below. So we've got pramipexole or Mirapex, ropinirole or Requip, and then rotigotine or Nupro. And these act like dopamine. Again, we can add it on to that carbidopa-levodopa. The big thing with these types of medications is they're associated with what's called an impulse control disorder. So, if someone's going out and gambling or they can't control their shopping all of a sudden after starting this medication, that could be related to the Mirapex if that's what they're taking. We also have a couple other medications. So these are called rasagiline or Azilect, and then selegiline or Zelapar. And the big thing to note with these medications is that they can actually cause an increase in blood pressure. So the other ones cause a decrease. These ones can cause an increase in blood pressure. We also have entacapone or Compton. It can only be used with the carbidopa-levodopa. Side effects are similar to the carbidopa-levodopa. And then the last one I wanted to mention to you all today is the istradifylline or Norrans. That is a new medication. So it's also very expensive, but that's a new one on the market. And something that's very important with these medications is that you take them as your doctor told you to. Really try to take them on time, because as Dr. Clemensen mentioned, the effects start to wear off and the patient might not be able to move. And again, we really want to make sure the patient can move and do what they need to do in their daily life. So all working to target dopamine, increase that dopamine, but again, not a cure. It's going to really help with the symptoms, those movement symptoms.
Thank you, Stephanie. We're going to talk just a little bit about the things that you can do as a patient to help yourself and help, and even your family or friends or any caregivers that you might have. Number one thing is we ask that you for sure see your doctor regularly, and that includes your primary care doctor like myself, or your neurologist, because certainly if you are diagnosed with Parkinson's disease, you would be seen by a neurologist as well, and they would help to manage your medications as well. As Stephanie mentioned, it's incredibly important to take the medications as prescribed. Timing with this type of medication is incredibly important because of the movement issues. Patients will have symptoms nearly immediately when the medications wear off. So, and as time goes and as the disease progresses, that becomes even more and more important. Also, as Stephanie mentioned, it's very important to know what are the side effects of your medication. What kinds of things can you expect to see or feel because of taking those medications? And then, of course, we always ask you to eat well, exercise, stay hydrated. And exercise is particularly important because we want you to stay strong and have good mobility and good balance, especially because that is one thing that's affected significantly by this disease is balance and walking. And then there are national and local support groups available in the U.S. for patients and their families and their caregivers. There's two, the American Parkinson's Disease Association, and then there's also the National Parkinson's Foundation. Both are excellent, and there are local groups in nearly every city. It's easy to get a hold of them. And of course, online, they're available as well. What questions do you have?
Two of those medications, the Mirapex and the Requip, were prescribed several years ago by my primary care physician for my RLS, and the side effects were so bad that I had to go off of the medication, and I told the doctor I can live with the symptoms, but I can't live with those side effects. So I have a new doctor now. That old doctor, he retired. My new doctor, he saw that I had tried the traditional medications, and he said, well, let's try something different. And he prescribed gabapentin.
Mm-hmm.
And I've been on that for, I think, about 7 months now, and it has helped with my RLS. And it also cured my overactive bladder as a positive side effect.
Hey.
And I talked to my urologist about that, and he said, yeah, that can happen. He said it's an indirect effect on the overactive bladder in that it takes away the pain or the urgency. And so all of a sudden, from day one, when I started taking gabapentin, instead of getting up about 3 times a night, I'm not getting up at all.
Awesome.
So that was a positive side effect from a non-traditional medication for RLS, but I understand what you're saying, that those are also, the primary medications for Parkinson's disease.
Yes. There's some relationship there. They're both considered to be movement disorders.
Mhm.
Pathways that the medications affect.
So the gabapentin has really helped my ROS, but I had to tweak the dosage. We started out real low, like a couple hundred milligrams, and now I'm up to 800, and that seems to kind of be the sweet spot. But unfortunately, it is a controlled substance, and I can't go on maintenance, and I can only refill it month to month, and I have to see my primary care physician every 3 months to stay on that.
Yeah.
Okay, I'm going to go ahead and see if there's any other questions.
Yeah, I have a question. I joined the meeting late, so maybe you did cover this, but is there any sort of like a screening test or symptoms that would indicate that you possibly have Parkinson's or are starting to have Parkinson's?
Sure. We actually don't have a standardized screening tool. It's usually more about educating folks and also reminding our physicians to look for things that can indicate Parkinson's disease in our elderly population. Some of the initial signs are what we call a resting tremor, and it usually starts in one arm or hand versus the other. And I think we scrolled back to the screen there, you'll notice that we often call it a pill rolling tremor because it kind of looks like it's just a little movement like this, like you're rolling a pill between your fingers. Other things are the initially people will sometimes have a loss of the taste, a sense of taste or smell. That can be pretty common, and it's often kind of subtle. But we do know that there's a direct relationship there as well. So probably tremor and the loss of taste or smell are probably the two initial signs that we see from people.
Have you heard of a screening where they can take your voice, like you speak, and they can determine it from that? I've heard of a tool that they've used for that as well.
Yeah, there's some testing that can be done based on changes in the voice and how basically the timing and intonation that can be done. I don't honestly know of anybody who does that. I'm sure it's available. It's probably not the first screening test that would be done or when it's suspected. In fact, Parkinson's is really what we would say a clinical diagnosis. There's no one test that we can do that says you have Parkinson's disease.
Perfect, thank you.
Yeah.
I just wanted to do a little commercial too. We have Delay the Disease and Dancing with Parkinson's fitness classes available. So if anyone's interested in those classes, we offer them virtually right now, but we also conduct them in person. We will be again in the future here.
Awesome.
I will add that kind of along all these lines, Dr. Clemensen will be back next month and she'll be talking on the topic of reducing the risk of falls.
Perfect. Perfect. So any other questions before we wrap up today?
I don't know about everybody else, but I first became aware of it because of Michael J. Fox, who contracted that disease at a very young age.
Yes.
And we haven't seen much of him recently. And I just wondered, has anybody kept tabs on how he's doing?
I honestly am not sure.
Not really.
This is Lois.
Yes, Lois.
Yes, Lois.
Okay, a couple things. One comment on the timing of the medicine. If you're going into my husband had Parkinson's for a number of years before he died 11 years ago. So it's interesting that only one new medication has come up since that time. That's rather interesting. A point, if a person has Parkinson's and goes into a hospital, I had written down, you need to be obnoxious. Maybe that's a bit strong, but let's say insistent, very persistent. As an advocate or as a patient, I have to take my medication at this time because the hospitals go on their own schedule. You really have to be really keep at them on that point. Also, just a sideline. In my own family, my husband's sister also had Parkinson's, and talking with a distant relative, discovered it probably came through on his father's mother's side,
Okay.
because there were several people from Finland who had this as well. And so this has been a source of anxiety for my kids. But then as I do reading on genetics and all that kind of stuff, anyhow, it's sort of interesting. All of that family married Finns.
Okay.
And Finland is sort of isolated country. So when you look at the long history of genetics, it could be they were reinforcing the same thing. And I'm telling my kids, I think the protection for them is that they are now a mix of Finn and German. And all of the grandkids are a mix of another country and nationality in there. So I think the mixing of people is really helpful.
I think that goes for animals too.
Yes, exactly. It helps if we're all mutts, right?
Lois, I think there's definitely some truth to that, in the regard that if there's a genetic link and you happen to marry someone or have children with someone that also has a genetic link, the offspring are going to have an increased risk, most likely, depending on how that is passed along. So there's definitely some, it is an area of study, and there are several actual genes that have been identified that are linked to the development of Parkinson's disease. So.
Perfect. Any other questions before we wrap up? Wonderful. Well, we really appreciate your time today. And thank you for sharing your vast amount of knowledge on Parkinson's disease. For any of you who are interested in sharing this information, it will be posted on our YouTube channel, Wood County Committee on Aging, Inc. Thank you, everyone.
Thank you.
Thank you
Have
so
a
much,
great day.
everyone.
Bye,
Have a great
everybody.
day.